I'm Dr. Christina, the Picky PT, and I'm here to tell you yet another position that you can do core strengthening in after having a baby, or if you deal with back pain, or you have a history of diastasis recti. So we've already gone over how to do strengthening when you're laying on your back for your core, strengthening when you're on all fours with your core, but now we're gonna go over how you could do it in tall kneeling. Because as a physical therapist, I know that not everybody understands how to use their core properly in the same position. Sometimes we do have to try exercises in different positions to get you to understand how to do it properly. So as a reminder, the number one thing that you should be thinking about when strengthening your core is that you should be pulling in on your abdomen as you're strengthening, not bulging out ever, all right? So from the side, that looks like you should be pulling in on your abdomen anytime you're strengthening your core, not bulging out. This is why for a lot of healthcare providers, they tell people to not do crunches or sit-ups while they're pregnant or after having a baby when they're suffering from diastasis recti, because a lot of people do those with bulging out rather than pulling in. So learning how to do core strengthening in other positions first can make it easier for your body and your brain to understand how to do it properly. So that's why we're going to go over tall kneeling today. If you like to learn more about exercise and how to use it to prevent and reduce injury or prevent and reduce everyday aches and pains that you might be dealing with, then make sure to like and subscribe to this channel, because I am the Picky PT and I go over every single video how to be picky about how you use exercise and make sure that you're not doing it incorrectly or compensating, so that way you get the most benefit out of it and it's actually worth your time doing. So for these tall kneeling exercises, we're gonna use a ball. We're just using like a squishy ball, not a weighted one, but you could do this with medicine balls if you move past this level of strengthening. We're gonna go over 3 different exercises, progressions that you can do with this. So the first progression that you're gonna do is you're gonna be in tall kneeling with your hips, knees in line with your hips, so you're not trying to be too wide or too narrow. You wanna be right in line. You can tuck your feet under so your toes are flat on the ground, or you can keep them down, whichever is easier for you to do this. But we're gonna have a squishy ball right about our chest, and we're going to actually squeeze in on it, all right? The reason we're squeezing in is because that activates our chest muscles, which helps to activate all of our front chain muscles together, all right? That front chain consists of muscles like your tongue, your neck muscles, your chest muscles, your core muscles, and your pelvic floor. So if you start pushing in, you'll notice that you already feel your core tighten, but you should feel it tighten in a way that you're pulling in, not pushing out, right? This would be pushing out, this is pulling in, okay? So we're gonna push in on that ball, pulling our core in, pubic bone to belly button, and then we're gonna lean back and use our core to come back up, all right? Leaning back, and then we're thinking, let me pull my core in even more so I can come back up. That's how we're using it. Lean back, squeeze that ball, and pull that core in. Now you're gonna feel this somewhat in your quads as well, because as you stretch back, you're lengthening them, and as you come forward, you may end up pushing your legs down into the ground to help you come back forward. But I want you to try your utmost to use mostly your core to pull you back up and not overuse your quad muscles to do this, okay? So we would start with doing this 2 sets of 10, and then if we felt like we had more in us after that first 2 sets of 10, you could go to 3 sets of 10. If you feel like after that 3 sets, you're like, I could do more reps per set, you could go to 2 of 15, 3 of 15, 2 of 20, 3 of 20. But if you can do 45 exercises in a row and you're not having to take a break at all, it's time to make this exercise harder. So we're gonna show you stage 2, or like I said, you could use something like a medicine ball to make this harder. So let's move on to stage 2. Okay, so level 2 of this core strengthening in tall kneeling using a squishy ball is going to be, again, we are going to squeeze that ball in, because that's gonna help us to use our chest muscles, which will help us to pull our core in, which will help us to use our pelvic floor as well. So we're gonna squeeze that ball in, and instead of going straight back and then coming up, what we're gonna do is we're gonna twist this time. So we're gonna dip back towards one side and then pull with our core to come back up. We're gonna dip back towards the other side and pull with our core to come up. Now what I want you to think about is as you lean towards this side, you are lengthening your muscles on the this is the left side of my body, so I'm lengthening my external rotators and lengthening my internal rotators on this side. So now I'm gonna think about pulling my rib cage back in towards center and pulling this side out away from center as I come back up. So I'm pulling back in, rotating back in. And same with the other side. Now I'm gonna pull back in, pulling my right rib cage back towards center and pulling my left side away from center. From the side view though, I wanna show you that ideally you wanna be able to do this without doing a whole lot of like arching your back, because that could lead to a lot of back pain. So you wanna make sure that you're starting in a pelvic tilt, your core's already engaged. As you twist away, you're staying nice and flat in that back and core, and you're not arching your back as you do that twisting, okay? Starting like the other exercises with 2 sets of 10, progressing to 3 of 10, 2 of 15, 3 of 15, 2 of 20, 3 of 20. And when you can do 45 in a row, it's time to either start with stage 3 or add a medicine ball to make this harder. Okay, so the last and final stage of a full kneeling with a squishy ball for core strengthening, we're going to practice stretching our core open and then quickly closing it by slamming the ball down, okay? So we're going to, instead of pressing in on the ball this way, we're gonna squeeze in with our arms more straight. We're gonna let the ball go overhead as we lean back, and then we're gonna slam it down as we come up again. Thinking about pulling that core in like a crunch, but you're up in a tall kneel, pulling the core in as you slam down, okay? So I'm squeezing in towards the center, and then as I come up, I'm pulling that core in to slam down. And once again, we're gonna squeeze in towards the center, leaning back overhead so our core is stretched out, and then we're gonna slam down with our core as we come back up. Now, if you want to add some resistance to this, you can use a medicine ball. You can stretch it up overhead and then slam down as you come back. That's obviously not gonna bounce up towards you, so you're gonna have to bend down and get it every time. But this is gonna use a lot more resistance in that core to come back up. All right, from the side view, you wanna make sure that as you're leaning back, you're not arching your back as you lean back, but instead starting with a pelvic tilt, pubic bone to belly button, pulling that core in already, leaning back with a straight core, and then we're pulling that core in as we slam that ball down. So start with 2 sets of 10, move to 3 sets of 10, go 2 sets of 15, 3 sets of 15, 2 of 20, 3 of 20. When you can do 45 in a row with no rest break needed, you need to increase the resistance of the medicine ball, or maybe even you decide to use a different resistance like a TheraBand and pulling that overhead as you come down and forward. There's all kinds of ways that you can modify and change exercises, and that's why if you try these exercises out and you're still having trouble with bulging, or you're still having trouble with back pain, or you're not noticing a difference in your diastasis recti appearance, you really need to reach out to a neuromuscular expert, a physical therapist, because oftentimes you can see these exercises online, you think you're doing them correctly, but then when a physical therapist gets their hands on you, they can really cue you how to do these with the utmost pickiness and making sure that you're getting the most benefit out of these exercises, or maybe start you with something more basic if that's where you need to start. So if you try these out and you find them helpful, or you would like some more exercises that are like this in this position, comment below, let me know. I'd be happy to make some more content just like this.